Yeah, well, the governor says his proposal on Medi-Cal is not something he wants to do, but it's something he feels he has to do to balance the state budget. Latino lawmakers in his own party, though, disagree.
Governor Newsom, we ask you, rethink this mistake.
I'm standing with our allies and our colleagues to say, Governor Newsom, this is not the solution.
Tough words for Governor Gavin Newsom from these Democrats in California's Latino Legislative Caucus. They say they're outraged over Newsom's budget proposal to pause the state's expansion of publicly funded health care to undocumented people. Specifically, Newsom proposed pausing new enrollment for undocumented Californians into the state's publicly funded Medi-Cal program, a program providing health care to low-income Californians. While undocumented children will still be covered under his proposal, undocumented adults not already in the program will not be able to join come 2026. As for the 1.5+ million undocumented Californians already on Medi-Cal, Newsom's plan calls on them to pay $100 monthly premiums.
We submitted a balanced budget.
During his budget presentation last week, Newsom said he would prefer not to make such proposals, but added the state faces a $12 billion deficit this year and even larger projected deficits in future years. He's concerned without his proposals, Medi-Cal would grow too fast and become too expensive.
There are investments that we are making that we simply cannot continue to make.
But the Latino caucus is pushing back.
Access to health care is a basic human right. The immigrant communities, they have provided nearly $9 billion in state taxes to our coffers. And what is their return on investment? Shutting them out of health care, a basic right?
The governor is proposing a troubling precedent, raising prices on one group of Californians based solely on their immigration status.
It's for that reason why San Leandro Democratic Assembly member Liz Ortega expressed concerns over the legality of the governor's proposal. She also believes in the long run, Newsom's plan will actually not save the state, arguing it will result in costly emergency room visits ultimately picked up by taxpayers.
Undocumented workers will continue to stay in the state of California. They will get sick and they will end up in our emergency rooms, which will cost the state more than it will save.
As for how they plan to continue funding Medi-Cal, Latino caucus leaders said they are open to a range of possibilities, including possible reforms aimed at reducing the price of high drug costs. When asked whether they would consider a tax increase to fund Medi-Cal, this was the answer.
It could be. I'm not saying specifically tax increases, everything.
And so now legislators and the governor have about 3 weeks to negotiate Newsom's budget proposals. The deadline to pass a balanced budget is June 15th. Reporting at the state capitol, covering local news that matters, Eitan Wallace, Fox 40 News.